Okay, super short on just some diagnostic imaging. Just a couple of slides here that you should probably be familiar with. So again, super duper short for this topic. So x-rays, you guys don't get to do x-rays, just as an FYI. But they do contain radioactive materials. So if helping with x-rays, check for pregnancy, making sure that you wear all the lead aprons, the door stays closed, just keep that in mind. Here's an example of an x-ray machine. Again, you guys don't set this up. It's real safety protocol here. I'm just looking to know if, it contains actual x-rays, which is radioactive, versus things that are a little bit safer for certain populations. Sometimes we do x-rays or any tests with something we call contrast. These show up as really bright white on the images. They usually contain radioactive substances, and you actually can't cross the Canadian border for 2 weeks after having one. So just keep that in mind, right? If patients are getting anything with the contrast medium. You as an MA can help give some patient prep. What can you anticipate and some knowledge throughout the procedure? I don't care that you know anything about the views, not important to me. Will be 0 questions. A fluoroscope is several series of moving x-rays. So this again is radioactive. You have to wear entire lead aprons to go in and assist with this procedure. So keep in mind that this is like hundreds of x-rays, so a lot of radioactivity here. Bone density, again, it's a type of an x-ray. It detects for things like osteoporosis. Again, because it's x-ray technology, what I really want you to understand is it's radioactive. So making sure that you protect yourself, right, and your patients as best as possible. So PET scans, PET does use, again, radioactive materials. They get slid into a tube. It's similar to an MRI in terms of what the tube looks like, except again, it's hundreds and hundreds of x-rays. In addition to, it requires the injection of the radioactive injection. So be very, very cautious when working with these patients and this technology. CT, again, we call it like a 3D x-ray. So essentially they slide through this very thin tube and the x-ray machine, goes in a circle around it. But again, it's a lot of x-rays, so radioactive material. MRIs are a little bit different. So MRIs use a magnet. There is no radioactivity with this, so extremely safe. However, because it's a giant magnet, make sure there's no metal in the room. It will suck it into the machine and destroy a $3 million machine. If patients have metal implanted in their body, absolutely cautioned not to have one of these done. They can't wear any metal on them during the tests. Including piercings and others. So making sure that they understand that they will be literally ripped from their body. It is such a powerful magnet. Ultrasound just uses sound waves. So of your types of images, this is the most safe. And in fact, we do this during pregnancy. It's just sound waves. They bounce back to the little wand that they place on you, and it just interprets it through the computer about the speed at which they bounce back, tells us about the structures underneath, so extremely safe. A mammogram does use x-ray technology. So again, making sure you have on your lead aprons, not in the room, right, and understanding that it does contain that sort of component. For documents, when it comes to films, reports, and other, they are part of the patient's official medical record. So please treat them as such. They are HIPAA protected. They need to be filed properly in the patient's chart. If you're working with cancer patients and chemotherapy treatment or radiation therapy treatment, again, this stuff is extremely toxic to you as an MA. And in fact, if you're doing chemotherapy, the bags will say not to touch things without gloves. Making sure you take that seriously is extremely, extremely important. And so it's really just the safety protocol that I care about here. There is a whole field of medicine for these radioactive compounds. It is called nuclear medicine, is just the name of the specialist. And that is all I really expect you to know about diagnostic imaging.